Daily feeding tip. What are my top 3 supporting factors that I want families to be thinking of when they're working on helping their child transition from eating through a tube to eating by mouth? Let's go. Number 1, I want this family working with the child's face and mouth every day. Just because their child isn't eating at this time doesn't mean that they don't still need to use this as an opportunity to practice and build and increase their coordination and skill sets. Because if we don't practice, we won't get there. Number 2, I want this child receiving stimulation in their mouth or practicing oral motor skills every single time that food is going into their belly through a tube. This is going to help their sense of interoception so that they start to make that connection between, oh, when I have stimulation at my mouth, I feel that feeling of fullness in my belly. Number 3, the third thing that I want to happen is even while most families that come home on a feeding tube or have a feeding tube placement might start on a pretty atypical schedule, I want to help them walk towards a typical mealtime schedule. So instead of having, let's say, continuous feeds or overnight feeds, I want to make micro changes from week to week so that that family and that child can start receiving their food, even if it's still through their tube, at the same time that their family is throughout their daily routine. Thanks for watching. If you enjoyed today's daily feeding tip, be sure to click subscribe below to join the Peds Feeding Tribe YouTube channel to get more content just like this and hear all my daily feeding tips.